Hi friends, good evening and welcome to my channel Mukambika Nursing. Here we can see some previous questions with answer. Today's question paper is BFUHS, that is Baba Fred University of Health Science recently conducted exam staff nurse exam. That question paper, here we can see the questions are comparatively easy questions. We will see the question. First question, which of the following is known to have a role in wound healing? Options: option A vitamin A, option B vitamin K, option C vitamin C, and option D vitamin B complex. Wound healing, which vitamin? Wound healing is vitamin C. Vitamin C is also known as ascorbic acid, which is important for wound healing. Second question, which of the following is considered as the most important aspect of hand washing? Options are: option A soap, option B friction, option C water, option D time. Most important aspect of hand washing. Correct answer is option B, friction. The next question, the process of introduction of weakened pathogens into human body is called. Options are: option A attenuation, option B immunization, option C vaccination, option D none of this. Process of introduction of weakened pathogen, that is introduction of weak antigen into the body and the body produces antibody, that is known as vaccination. Okay, option C is the correct answer. The next question, which of the following vitamin is soluble in water? Options are: option A vitamin A, option B vitamin K, option C vitamin D, and option D vitamin C. Water soluble vitamin. Correct answer is option D vitamin C. A, D, E, K all fat soluble vitamin. Vitamin C is water soluble, vitamin D is the correct answer. The next question, all are macronutrients except. Options are: option A protein, fat, option B fat, option C vitamins, option D carbohydrate. Macronutrients except. Correct answer is option C vitamins. Remaining carbohydrate, protein, fat or macronutrients. Vitamins and minerals are micronutrients. And the next question, deficiency of vitamin D in children's may cause. Options are: option A osteomalacia, option B rickets, option C pellagra, option D beriberi. Deficiency of vitamin D in children's may cause rickets. In children's it may cause rickets and in adult it cause osteomalacia. So here answer option B. And the next question, question number 7, excess accumulation of bile salt in body. Options, option A pruritus, option B prostatitis, option C psoriasis, option D dermatitis. Excess accumulation of bile salt in the body is known as option A pruritus. The next question, the only artery which supplies deoxygenated blood is. Options are: option A pulmonary artery, option B hepatic artery, option C renal artery, option D gastric artery. The only artery which supplies deoxygenated blood. Correct answer is option A pulmonary artery. Pulmonary artery which carry deoxygenated blood into the lungs. Okay, here correct answer is option A. The next question, which is the best method of health communication to motivate an eligible couple for adopting contraceptive practices? Options are: option A group discussion, option B printed material on family planning, option C face-to-face communication, option D use of internet. Question is, best method of health communication To educate the eligible couple for adopting contraceptive method. Okay, the best method is face-to-face communication. The next question, oral administration of vitamin A solution periodically to preschool children and school age children is an example of. Options are option A primordial prevention, option B primary prevention, option C secondary prevention, option D tertiary prevention. Question is oral administration of vitamin A solution to school age and preschool is an example of. Option B, primary prevention. It is an example of primary prevention. Option B is the correct answer. Oral administration of vitamin A solution. Move on to next question. Airborne precaution for a patient with pulmonary tuberculosis has to be taken until. Options are option A tuberculin test is negative. Option B patient no longer has the disease. Option C no tubercle bacilli present in the sputum. Option D patient temperature has returned to normal. Question is pulmonary tuberculosis patient has to taken the airborne precaution until no tubercle bacilli present in the sputum, until they should take precaution when there is no tubercle bacilli is present in the sputum. So sputum test is important here. Okay, option C. The next question, oral rehydration solution contains all of the following except. Options are option A glucose, option B bicarbonate, option C calcium chloride, option D calcium lactate. ORS solution contained all the following except. Correct answer will come option D calcium lactate. The ingredients of ORS solutions include sodium chloride, potassium chloride, sodium citrate and dextrose. Okay, or the electrolytes include sodium, potassium chloride, citrate and dextrose. Okay, so here calcium lactate is not the content of ORS solution. The next question, metronidazole is the drug of choice for. Options, option A bacterial infection, option B viral infection, option C anaerobic bacterial infection, option D aerobic bacterial infection. Metronidazole is the drug of choice for. Correct answer is option C anaerobic bacterial infection. Okay, option C is the correct answer. Move on to next question. The first and most common symptom of intussusception in children is. Options are option A pain in abdomen, option B diarrhea, option C vomiting, option D abdominal distension. Question, the first and most common symptoms of intussusception. Correct answer is option A, pain in abdomen. Intussusception is the telescoping of intestine. So here pain is the first and most common symptom. The next question, celiac disease is due to sensitivity to. Options are option A milk, option B wheat, option C maize, option D meat. Celiac disease. Correct answer is option B wheat. Celiac disease is also known as gluten enteropathy. This gluten which is present in barley, rye, oats and wheat. Okay, so here wheat is there, so celiac disease is due to the sensitivity of wheat. Option B. The next question, drug of choice to treat giardiasis. Options are option A mebendazole, option B metronidazole, option C piperacin, option D bipernium. Drug of choice to treat giardiasis. Correct answer is option B metronidazole. Okay, the drug of choice to treat giardiasis is metronidazole. The giardiasis is a diarrheal disease which is caused by Giardia duodenalis. Okay, this metronidazole is usually given to treat anaerobic bacterial infection. Okay, here option B is the correct answer. The next question, all are barrier contraceptive except options are option A male condom, option B female condom, option C diaphragm, option D mala D. Which one is not an example of barrier condom? Correct answer is option D mala D. Remaining male condom, female condom, diaphragm all barrier condom. Example of barrier contraceptives. Here mala D is a tablet. Okay, so mala D is the correct answer. The next question, carrier are more dangerous than case because they option A increases virulence, option B increases duration of disease, option C more infectious, option D infect more people. Carrier are more dangerous than case because they infect more people. Option D is the correct answer. Move on to the next question. A child with respiratory insufficiency is best monitored with. Options are option A respiratory function test, option B blood gases, option C pulse oximetry, option D blood pH. Respiratory insufficiency is best monitored with pulse oximetry in children's. Option C is the correct answer. Next question, when the nurse is inserting nasogastric tube to a toddler, which of the following restraints should be the most appropriate for the nurse to use? Options, option A mummy restraint, option B claw hitch, option C elbow restraint, option D jacket restraint. Here nurse is putting nasogastric tube to toddler. So which is the most appropriate restraint she can use to toddler? Correct answer is option A mummy restraint. So mummy restraint she can use to toddler during nasogastric tube insertion. Option A is the correct answer. The next question, hospital acquired infections is called. Options are option A contagious infection, option B opportunistic infection, option C nosocomial infection, option D waterborne infection. Hospital acquired infection is known as option C nosocomial infection. Hospital acquired infections are known as nosocomial infection. Move on to the next question. Family planning refers to practice that. Options are option A avoid unwanted birth, option B brings about wanted birth, option C regulates spacing between the pregnancies, option D all of this. Family planning means option D all of this. That is family planning include avoid unwanted birth or family planning to bring wanted birth, also regulate the spacing between the pregnancies. Okay, so correct answer is option D all of this. The next question, the most important stage of nursing practice is. Options are option A evaluation, option B assessment, option C planning, option D implementation. Which is the most important stage of nursing practice? Correct answer is option B assessment. We are assessing the patient, that is the most important stage. The next question, the duty to protect privileged information is called. Options are option A morals, option B ethics, option C honesty, option D confidentiality. Nurse, the duty to protect privileged information is called confidentiality. Option D is the correct answer. The next question, To protect the person's personal space, the nurse should. Options are option A, avoid communication. Option B, ensure the curtains are pulled around the patient bed. Option C, stand 2 meters away from the bed. Option D, explain the nursing care and procedures. Here, person mean patient. To protect the patient personal space as a nurse, what we can do? We should explain the nursing care and procedure. So before doing each and every procedure, we should explain to the patient. That is the important aspect to protect the person's personal space. Question number 26. Which of the following is classified as subjective data? Option A, patient appears sleepy. Option B, no distress noted. Option C, heart rate is 76 per minute. Option D, client says she feel anxious and tensed. Subjective data means what the patient is telling. That is subjective data. Subjective data means what we are observing. Here, subjective data. So, answer is option D. Client says she feels anxious and tense. What the patient is telling, that is subjective data. Client says she feels anxious and tense. Option D is the correct answer. The next question. Which of the following condition is most commonly responsible for myocardial infarction? Options. Option A, coronary artery thrombosis. Option B, diabetes mellitus. Option C, renal failure. Option D, cerebrovascular accident. Most common factor or responsible factor for myocardial infarction. Responsible condition for myocardial infarction is coronary artery thrombosis. Occlusion of the coronary artery which cause MI or myocardial infarction. Option A is the correct answer. Move on to the next question. The primary aim of treatment in heart failure is. Options. Option A, increases the work of the heart preload and afterload. Reduces the work of the heart preload and afterload. Option C, reduce the work of the lungs. Option D, reduce the glomerular filtration rate. The primary aim of treatment of heart failure. Already the heart is failure, so we have to reduce the work of the heart preload and afterload. Option B is the correct answer. Move on to next question. Cessation of breathing for a short period is called. Options are option A, dyspnea. Option B, orthopnea. Option C, apnea. Option D, bradypnea. Cessation of breathing for short period is known as. Option C, apnea. The next question. Midway through a blood transfusion, a patient complains of severe back pain. What should the nurse do? Options. Option A, reassure the patient and continue transfusion. Option B, stop transfusion, take the vital signs and inform the nurse in charge. Option C, speed up the transfusion and complete it quickly. Option D, none of this. Question. While giving blood transfusion, patient complains that he is having or she is having severe back pain. That time what she should do? Immediately we should stop the transfusion. We should stop the transfusion and inform to the doctor here. Inform the nurse in charge is there. So we should inform to the nurse in charge. Option B is the correct answer. The next question. The 3 P's of pain management are. Options. Option A, posture, physiological care and pharmacology. Option B, physical care, physiological care and position. Option C, physical care, physiological care and pharmacology. Option D, physical care, psychological care and pharmacology. 3 P's of pain management. Correct answer is option D, physical care, psychological care and pharmacology. Physical, psychological and pharmacology. The next question. Infectious agents are. Options. Option A, biological agent that cause disease or illness to their host. Option B, nuclear agent that cause disease or illness to their host. Option C, biological agent that do not cause disease or illness to their host. Option D, nuclear agent that do not cause disease or illness to their host. Infectious agents are biological agents that cause disease or illness to their host. Option A is the correct answer. Move on to the next question. Personal protective equipments PPE is implemented to. Options. Option A, protect patients from risk of infection. Option B, protect healthcare workers and patients from risk of infection. Option C, protect healthcare workers from risk of infection. Option D, protect healthcare workers and patients from risk of radiation. PPE is implemented to protect healthcare workers and patients from risk of infection. So from the patient, infections are transferring to the healthcare workers. So PPE is implemented to protect both patient and healthcare workers. Protect healthcare workers and patients from risk of infection. Option B is the correct answer. The next question, which is usually a rare cancer associated with HIV? Option A, astrocytoma. Option B, mesothelioma. Option C, pineal cancer. Option D, Kaposi's sarcoma. Correct answer is Kaposi's sarcoma is the rare cancer which is occurring in the HIV patient. Move on to the next question. The butterfly rashes often seen in some people with systemic lupus erythematosus is found on. Options. Option A, the back. Option B, the leg. Option C, the face. Option D, the neck. In systemic lupus erythematosus, the butterfly rashes appears in face. Option C is the correct answer. The butterfly rashes are seen in face in systemic lupus erythematosus patient. Option C is the correct answer. The next question. Asthma can be triggered by. First option A, house dust mite. Option B, emotional and environmental factors. Option C, emotional factors only. Option D, environmental factors only. Which factor can aggravate the asthma? Correct answer is option B, emotional. Both emotional and environmental factors can trigger the asthma. The next question, which of the following is considered normal for intracranial pressure? Option A, 0 to 15 mmHg. Option B, 25 mmHg. Option C, 35 to 45 mmHg. Option D, 120 by 80 mmHg. Normal intracranial pressure is 0 to 15 mmHg. Option A is the correct answer. Move on to the next question. When a patient has non-angina pectoris complaints that is having chest pain more often even when he is resting. The period of pain is longer and takes less stress for the pain to happen. This is known as. Options. Option A, variant angina. Option B, unstable angina. Option C, refractory angina. Option D, irritable angina. So here already the patient is having angina pectoris and he is complaining chest pain. While he is resting also he is having chest pain. The period is less and patient is having stress for the pain, that is known as unstable angina. Option B is the correct answer. Okay, pain even when the patient is taking rest, that is known as unstable angina. The next question, what is the most important test for iron stores? Option A, serum calcium. Option B, serum iron. Option C, serum ferritin. Option D, none of this. Most important test for iron stores. Correct answer is option C, serum ferritin. The next question, which of the following would be the most appropriate first line treatment for a person with primary generalized tonic-clonic seizure? Options. Option A, digoxin. Option B, sodium valproate. Option C, phenytoin. Option D, diazepam. Most appropriate first line treatment for generalized primary generalized tonic-clonic seizure is sodium valproate. Option B is the correct answer. The next question, what are the advantages of using pen-like insulin delivery device? Option A, shorter injection time. Option B, accurate dose of delivery. Option C, lower cost with reusable insulin. Option D, use of smaller gauge needles. Question, advantage of using pen-like insulin delivery device. Okay, by using pen-like insulin delivery device, we can make accurate dose of delivery. Option B is the correct answer. The next question, which of the following is the most common cause of goiter? Correct options, option A, iodine deficiency, option B, iodine excess, option C, kwashiorkor, option D, insulin deficiency. Question, most common cause of goiter is goiter. Correct, most common cause है option A, iodine deficiency. The next question, what length of the catheter tip should be inserted into the rectum for giving enema to an adult patient? Options, option A 2.5 to 5 cm, option B 5 to 7.5 cm, option C 7.5 to 10 cm, and option D 10.5 to 12 cm. So the length, how much length will be inserted, tip of the catheter should be inserted into the rectum for adult patient while giving enema. Okay, for an adult patient. Correct answer is option C, 7.5 to 10 centimeter. Okay, the tip of the catheter should be inserted 7.5 to 10 centimeter in adult patient. Next question, which of the following is an antidote of heparin? Option A, potassium sulfate, option B, protamine sulfate, option C, magnesium sulfate, option D, morphine sulfate. Okay, so here by fastly, maybe by mistake, we will make option A, potassium sulfate. No, it is protamine sulfate. We have to read the question, we read the option thoroughly. Option B is the correct answer, protamine sulfate. The next question, if left untreated in women with chlamydia can lead to? Options, option A, hepatitis, option B, peripheral vascular disease, option C, pelvic inflammatory disease, option D, uterine fibroid. Here, chlamydia infection is not treated. That may lead to pelvic inflammatory disease. Option C is the correct answer. Chlamydia is a sexually transmitted disease. The next question, there is no cure for eczema. So the treatment aims to, option A, prevent cross infection, option B, control or ease the symptoms, option C, prevent dehydration, option D, encourage tissue regeneration. Here, no cure for eczema. In that case, the treatment aims to control or ease symptoms, to prevent symptoms. Option B is the correct answer. Move on to the next question. Which gauge intravenous catheter is commonly used for blood transfusion? Options, option A 18 gauge, option B 22 gauge, option C 24 gauge, option D 26 gauge. For blood transfusion, which cannula we can select? 18 gauge. Option A is the correct answer. Biggest size cannula is using for blood transfusion. In which color dustbin the nurse will discard the vial of injection methotrexate? Options, option A white, option B blue, option C red, option D green. So the vial of the injections are discarded in the white dustbin. Option A is the correct answer. Next question, a circulatory nurse is anticipated to perform which of the following role? Circulatory nurse role. Option A, assisting the surgeon. Option B, control all sponges post-operatively. Option C, performing surgical scrub. Option D, verifying the consent. Here question, the role of a circulatory nurse. Circulatory nurse should verify the consent. Option D is the correct answer. Move on to the next question. A successful communication has three main components. Option A, verbal, non-verbal and ambient. Option B, listening, eye contact and responding. Option C, paying attention, paraphrasing and responding. Option D, sender, receiver and message. For successful communication, we need a sender, receiver and message. The three main components in the successful communication. In this section, we discuss the first 50 question. Next 50 question we can see in the next video. Okay, thank you for watching my channel. Mostly this question will be useful for your coming exam.